Picture the mid-20th century, a time when the United States was a hotbed for medical access and development. The advancements made within the industry during the wartime of the previous decade allowed for an unprecedented level of progress within the industry, both in terms of knowledge and convenience. Around this time, doctors and psychologists have been paying attention to mental illness, a field marked by and large by mystery at the time. In particular, doctors set their sights on psychotic disorders. It is not uncommon for an individual to become a danger to themselves and others when influenced by these disorders, which makes the understanding and treatment of them a significant priority amongst medical and mental health institutions. For many of you, these symptoms are all too familiar. Antipsychotics are medications taken by patients diagnosed with these ailments, which work by impeding the D2 dopamine receptor in the brain, a membrane whose hyperactivity has been routinely linked to psychotic symptoms. Many of you likely have been exposed to these medications without true knowledge of their effects. To the layman, the prescription of antipsychotics may appear to be the encompassing solution for those suffering from antipsychotic disorders. After all, they have been shown to decrease relapse rates by over 20% in the short term. There is more to this story than meets the eye, however. While antipsychotics have been shown to give benefits, they may not be the end-all solution medical entities peddle them as.
Alright, what adverse effects do antipsychotics have on the patient?
A scientist named Maurice Rappaport conducted a series of studies in which the true drug-free group of schizophrenics was hospitalized and treated through alternative means such as therapy and rehabilitation, while a parallel group was treated using antipsychotics. Over the course of a 3-year follow-up study, Rappaport discovered that a mere 8% of the non-medicated group experienced rehospitalization for relapse, compared to a staggering 73% rehospitalization rate for those who remained on the medication beyond their time in the hospital.
So as a patient, what are some alternatives to medication?
Only hope to remain delusion-free. These include group therapy, a strategy which resulted in patients faring significantly better than their counterparts, rehabilitation and supported employment, which assists bipolar and schizophrenic patients in finding jobs, adjusting to normal life, and interacting with others regularly, or low-level medications such as antidepressants and anti-anxiety drugs, which allow for some of the negative symptoms of schizophrenia and bipolar to be dealt with without the negative effects of heavier-duty antipsychotic.
What is the research base for moving away from antipsychotics?
The fundamental base for medicating psychotic disorders has been built on flawed studies and data. The continued use of and reference of these studies within the contemporary medical field reflects a definite need for reevaluation. These notions were confirmed by the World Health Organization in an international study comparing outcomes of schizophrenia in various countries. The study compared functional outcomes of schizophrenia in developed countries with strong healthcare infrastructure and pharmaceutical presence in countries lacking with these features, some of which being South America, Africa, and Southeast Asia. The results were rather shocking to the researchers, as the evidence pointed to the less developed countries as those with the most positive outcomes. This could be due to a combination of various theorized components, including natural remedies, a focus on therapy, or more exposure to the natural world. However, the only consistent variable across the country studied was the lack of access to prescription drugs such as antipsychotics. This claim, as surprising as it may be, has been confirmed and reconfirmed over the years by various medical entities, all arriving at the same result. Let's take a look at what it might be like to live with a psychotic disorder.